And we'll stop sharing my screen for now. Um, Stop sharing. There we go. Um, okay. Well, again, thanks everybody for being here. My name's Charlie Fisher. I'm the state director with OSPERG. We're a statewide member-funded public interest organization, and we're here to release a new report called Price Transparency at Oregon Hospitals, examining the usefulness of consumer price information. So, in this webinar, which should be brief, I'm going to provide some context, talk about our findings, walk through a couple hospital websites to actually give examples of what we're talking about, and finally, highlight several proposed policies in the legislature that are related to hospital pricing. So, first of all, let me just talk a little bit about why price transparency is important. Knowing the price of a good or service in advance of buying it is just a basic consumer right and is essential to any competitive, well-functioning market. In healthcare, however, price transparency has often been the exception rather than the rule, and hospitals have historically failed to share pricing information with the public, making it difficult for people to make informed healthcare choices. Now, obviously, price transparency by itself isn't a silver bullet. There are more things that need to be done to address high healthcare costs. However, price transparency does have multiple benefits. When a consumer knows what a medical service will cost before scheduling it, they have the opportunity to compare prices and take the cost of treatment into account when choosing a healthcare provider. They can also prepare financially for paying for the cost of the care, reducing the potential for unexpectedly high bills to disrupt their financial health and well-being. And in instances where they're choosing between different insurance plans or companies during open enrollment, knowing how much they can expect to pay for a regular or upcoming procedure can help them make a more informed decision. In addition to providing benefits to consumers, price transparency also gives researchers and policymakers access to data that can be used to determine how prices are set and whether intervention may be appropriate to maintain a competitive marketplace. And finally, for insurers and self-insured employers, price transparency may help them negotiate better deals with hospitals, with the savings potentially passed on to consumers. So the context for these transparency websites is the Federal Centers for Medicare and Medicaid Services established a pricing disclosure rule effective since January 2021 that requires hospitals to disclose more information about prices for common procedures and services on their websites. An updated version of the rule went into effect January 2024, requiring more standardized formatting, stronger enforcement, and a link on the homepage that leads to price transparency tools for simpler consumer access. These measures are intended to make pricing information publicly available in a useful and usable format so that consumers can make informed decisions about their care. So our report, or for our report, we reviewed the hospital websites of 59 Oregon hospitals in between October and December of 2024 to determine how useful and usable these websites are. Now, there are two ways hospitals can give patients access to prices. The first is through a price estimator tool in which consumers answer a few questions and are given a price estimate. The second is through a simple shoppable services list. Both have their own pluses and minuses. Price estimator tools are easier to navigate and more accessible for mobile devices, but sometimes have less comprehensive information. Whereas shoppable services lists, which are often just formatted as large spreadsheets, are inherently more difficult to sift through for the average consumer, but can be more comprehensive. So as a result, we, in our report, found that the best practice was for hospitals to include access to both. And so again, this is a snapshot in time. We did this report at the end of last year, and we think that hospitals will hopefully update their websites to make them better. Maybe some of them already have. We'll see. Um, but the findings in our report were as follows. There were only 20 of the 59 hospitals so that's 34%, that provided useful and usable, although sometimes imperfect, consumer-oriented price transparency tools. The hospitals in this category generally offered prominent links to price transparency tools on the homepage, included at least some of the required information, and had usable consumer-friendly tools. The majority of hospitals, 36, so 61% of hospitals, provided tools with serious limitations to accessibility and were therefore limited in usefulness. One of the primary deficiencies found on many of these websites was that they required personal identifying information in order to get an estimate. If insured estimates are only accessible when consumers provide insurance information, patients who are also shopping for insurance plans are barred from viewing estimates, and the value of comprehensive price information for researchers, lawmakers, and the media is diminished. I should say, this is the main limitation was access to the price for a particular insurance company. All of these had access to or most of them, the cash price. But if you're shopping for insurance, uh, or trying to understand what the different prices are for different insurance companies, then you're out of luck. And finally, three hospitals, so that's 5%, lacked any usable information to the extent that they could be considered non-compliant with CMS guidelines. So I'm going to quickly demonstrate the three tiers of websites that we surveyed. So the first we called useful and usable. So I'm going to share my screen here again and provide some examples. Uh, and our report has all of the different hospitals ranked or tiered by these categories. We're just choosing one, um, but it should be representative of what generally what we're talking about. So the first one I want to highlight is legacy health. So I'll share my screen. Can everybody see that? Just give a thumbs up. All right, great. Okay, so this is the Legacy Health website. The first thing to look for is whether or not the price transparency tool is accessible via the homepage. Now, ideally, we'd like this to be uh, right, prominently on the front page. And so we don't see that here, but if you go to what I would think is the most intuitive category, patients and visitors, you can go to price transparency and find it there. So then the second thing to look for is there both a shoppable services list and a price estimator tool. You can scroll down, there's a price estimator tool, and you can download the pricing transparency file. So if you were to download the Legacy Emmanuel Medical Center, I'll show you what this looks like. And as you can see, it's quite a dense spreadsheet. Uh, so very comprehensive. And for a knowledgeable and motivated consumer, probably a useful piece of information. Um, but the obvious downside is that it's pretty dense and doesn't readily give you the information you need. Um, so let's go back to the Legacy website and we'll walk through the price estimator tool. So one thing to note about price estimator tools, which is a downside, is oftentimes they have this disclaimer basically saying, we can't guarantee this is what the service is actually going to cost. It's just an estimate. So ideally, you would be able to get a binding quote from a hospital. Unfortunately, this doesn't do that. So that's just an inherent deficiency in the current um, price transparency requirements that we want to highlight. But nevertheless, um, you can still get an estimate. So we'll choose for this purposes Legacy Manual. Hit next. And then the key question here is, can you access insurance information without providing personal information? So for the purpose of this, let's choose, my screen is a little bit difficult to navigate right now. Um, so we'll choose Aetna. Go next. Um, the next thing to look for, which is good, is you can choose between an outpatient or inpatient procedure. This is important because the cost for an inpatient versus an outpatient procedure can be quite different. And it's important for consumers to know and be able to choose which one they're getting an estimate for. So here you can choose different procedures or choose a specialty. One of the things that we commonly did in our research was just do a knee x-ray, which is a common procedure. And so you can scroll down, x-ray of knee, three views. Um, and the good news is you're able to get a quote or an estimate by inputting your own insurance numbers, or at least what, if you're shopping around, what the different choices are. So just to explain these terms quickly, a deductible is the amount which you must pay yourself before your insurance covers any costs. So, for example, a plan with $1,000 deductible would require you to pay for your first $1,000 of medical care each year before the insurance company would cover any portion of the cost. Office visits are typically exempt from the deductible, meaning you would just pay the copay amount, which is down here. The second thing I want to highlight is the co-insurance patient portion. So this cost sharing method usually kicks in after you hit your deductible. It requires a patient to pick up a certain percentage of the cost of procedure while the plan covers the rest. So, for example, if the co-insurance patient portion was 20%, that means the patient would pay 20% of the overall cost, and the insurance plan would pay the remaining 80%. And finally, the out-of-pocket max is if you've gone over the deductible and you're paying your co-insurance portion, once you've hit the out-of-pocket max, uh, that's the most that you'll pay this year, above which your insurance covers 100% of the costs of any additional medical care. So for this, we'll say deductible is $5,000, out-of-pocket max is $10,000, um, co-insurance portion, let's say 20%, and you can calculate payment and get an estimate that the tip that on average the median you would pay if you had Aetna would be estimated to be about $42 towards your deductible. Now, if you had a copay, you would pay that potentially, but for the purposes of this exercise, we're just saying $42 for deductible. Now, just to give an example of how much it can differ between insurance plans, let's go back and choose Cigna insurance. So same thing, not planning to stay overnight. Knee x-ray, same insurance, 20%. And here, the estimate is $162 median. So you can really see the value of shopping around and knowing what the different insurance companies may be, what you may have to pay depending on what insurance you have. And you can see the high range is as much as $226. So this shows the value, though somewhat limited, of being able to get a price estimate without having to provide personal information and without having to be enrolled in a particular insurance plan in order to get that estimate. So let me stop there, and I will show. So that was the useful and usable, an example of a useful and usable hospital transparency website. Now I'm going to show an example of one that we deemed of limited usefulness. So this is Providence. So I'll share my screen. So once again, you want to look for the price transparency button on the page. Um, looks like it's a little harder to find. Um, here we go, price estimates and transparency. That's not so hard. And then the next thing to look for is, well, let's click this for Oregon hospitals. There you go. You can get the price estimate. Let's see if you can find a shoppable services list. Uh, let's hit price transparency. There we go. So these are all the hospitals. Um, let's go down to Oregon. So let's say for Providence, Portland, looks like there's not access to a shoppable services list. There's something called a JSON file, which is a big machine readable file that researchers can use if they have the right software, but not something that a consumer would be able to access. So this is one of the deficiencies. There's no shoppable services list available, meaning a consumer really has to rely on this price estimator tool in order to get a idea of what a particular procedure is going to cost. So let's go back to the patient estimate. We'll choose Portland Medical Center. Again, this is the deficiency. It's just an estimate. And now we'll search knee. Let's do knee X-ray, 3 views. And so you can skip this step if you don't have insurance in order to get the cash price. So if you're just paying out of pocket, you don't have any insurance, you can get the estimate. But let's see what happens if you choose Aetna insurance like we did before. Unfortunately, you have to provide the member number, your first last name, your date of birth to even get an estimate from this particular insurance company. It's true for Providence, for United Healthcare. So this is the main problem that we found with many hospitals. It simply is impossible without being a member of the insurance company already to get a price estimate. Now, if you are a plan member, then you can get an estimate, and that's good for those consumers. But for anyone else who wants to compare insurance companies, shop around for different plans, they unfortunately are not able to access that information on these websites that we deem to be limited usefulness. So finally, I just want to share briefly the last category, which we deem to be not usable or not useful. This is the Blue Mountain Hospital. Uh, and you can see there really just isn't any information. You might think that patient resources would have it. You can pay your bill. Maybe it's under financial assistance policy. Unfortunately, it's not. It's just a PDF. So we would deem this hospital to be not useful, potentially non-compliant with CMS regulations. Um, the good news is that there are only a couple hospitals like this, only 3. But I think this hopefully provides an example of the range of usefulness that a hospital price transparency tool can provide to consumers. So let me stop sharing my screen and wrap up with just a couple comments, and then I'm happy to answer questions. So I want to finish by just drawing attention to 2 bills in the legislature right now that would help address confusing hospital prices. First is a bill that would codify federal price transparency rules into state law. Those are there are 2 bills, House Bill 3557 and Senate Bill 1060, which would require that every hospital have at least a shoppable services list. It would also allow the state, as well as consumers, to enforce the law against non-compliant hospitals. So this would set a floor for the information being available on every website. Uh, our recommendation to hospitals if this bill were to pass would be to also provide a price estimator tool. Um, so that's the first bill. The second is a bill that would require advanced patient notice for hidden hospital charges known as facility fees. So facility fees are intended to cover the cost of running a 24/7 operation, so a hospital or an emergency room. But oftentimes consumers don't know that they're going to be charged them, and they can cost anywhere between a few dollars and thousands of dollars. Increasingly, we're also seeing these facility fees be charged at outpatient clinics that are owned by a hospital. So under those terms, the justification for a facility fee uh, at all is questionable, given that it likely is not a 24/7 facility and people are going there for regular procedures or services that ideally, since they're given off outpatient, would actually be cheaper. But we have some data in Connecticut, the state with the best data on the issue, found that total facility fee revenue in 2021 was more than $400 million, dollars, or around $400 per patient visit. So Senate Bill 539 would require advance patient notice and reporting to the state for facility fee charges, and would also prohibit facility fee charges for services done off campus from a hospital campus for many services that could be done at an outpatient facility. Senate Bill 539 has a hearing in the Senate Healthcare Committee on Thursday. So with that, I'm glad that you all are attended, and I'm happy to answer any questions. We'll also send a press release and happy to talk offline later if you have any follow-up questions. So I'll open the floor.
Oh, I had a question. So has there been any, so I know President Trump has signed an executive order recently to double down on the federal price transparency rules, and it calls for more audits and enforcement. I was wondering if, and so that applies for both health insurance companies and hospitals. Um, has has there been an issue with, um, is it because, has there been a lack of audits or enforcement in the state level because hospitals are audited at the federal level, or?
Um, yeah, well, I mean, I think so. Since this is a federal regulation, um, there currently is no jurisdiction for states to enforce it, which is why I think it's important to codify these transparency rules into state law so that the state government and attorney general and consumers who actually are closer to the ground have the authority to um, enforce the law in cases where hospitals are non-complying. Related to President Trump's uh, executive order, we saw that, and I think like the spirit of it, uh, I think our national folks haven't really gotten too much additional information about what the implications of that are in terms of rulemaking from CMS. So we're waiting on that information before we can really speak in detail about what the impact will be. But I think in general, um, increasing enforcement at the federal level is definitely a good thing, and we're happy to see that that's a direction that they're moving. Other questions?
Yeah, I had a question. Could you, it sounds to me like with your guys' report that the hospitals were divided into three different categories, one being acceptable, mildly acceptable or limited in acceptability, and then not acceptable, where you said
Mhm.
three hospitals landed. Can you explain a bit more about your ideology in deeming a hospital acceptable versus the middle category of mildly? So I'm just wondering what factors it took to get into that perfect score.
Yeah, sure. And I should say it's not a perfect score.
Hmm.
I don't think anybody's got a perfect score. And I mean, honestly, as I said, transparency is only part of the equation. And the federal price transparency rules also, I think there's room for improvement. So I think our goal was to look at what is currently there and see, with that context, what is actually useful to consumers in finding a price estimate. And so that was the primary lens through which we looked at this. And I think the biggest differentiator between the useful and usable and the limited usefulness was that personal identifying information requirement. And so, for example, we in our research, a consumer who is not a member of a particular plan uh, is just unable to get a estimate for what the price would be for a particular insurance plan without providing that information or without even having that information. And so, from our perspective, that is one of the key things that limits the usefulness of these price transparency tools. Any person should be able to go on a hospital website, type in the information that we did on the legacy website, choose an insurance plan, and get an estimate for what the price would be. And so many of the hospitals that we deemed limited usefulness failed that test. And we think that's kind of a minimal bar that needs to be cleared in order to be seen as a useful and usable website.
Thank you.
Yeah.
I had a question about do you think that since these federal hospital transparency laws um, took effect, prices in have lowered? Has it helped contain the cost of health?
Um,
Yeah.
that's a good question. I don't think I have the data to say one way or the other. Um, I think given that they've only been in place for a couple years, um, if they were going to lower healthcare costs, I think we'd need a little bit more time to see that, especially given that the updated rules that really did increase some standardization and uh, enforcement only went into effect uh, at the beginning of this of last year. And so we're kind of at the beginning stages. Um, it remains to be seen. I think transparency by itself, as I said, is not sufficient to address high healthcare costs. It's maybe just a necessary first or second step. So I'm hopeful that it'll have some impact. But I think it also just shows that there's more that we need to do beyond just transparency.
And how common or I guess how common are facility fees? Like a lot of health systems have bought up medical practices over the years, and I don't know if they usually tack on the facility fees at the outpatient, or is that hard to find out?
Yeah, so that's one of the things that the Senate Bill 539 is attempting to answer. We have heard anecdotally from consumers that some hospitals are charging facility fees at off-campus outpatient facilities. Um, so we know it's happening in Oregon. We know even more that from data that other states have brought because of similar bills that it's happening there, and so it seems reasonable that it is happening in Oregon. But I think the first step is to require reporting, require advance notice to consumers, and then in the cases where, it really doesn't make sense from the justification of a facility fee to be charging one at just a clinic that is off campus and maybe was acquired by the hospital, um, that those should just be prohibited. So, yeah, we know it's happening. We don't know how widespread it is, and we're hoping that this legislation will help answer that question. Okay. Well, thanks everyone for joining. As I said, I'll send out a press release after this, which has my contact info. So if you have any follow-up questions, I'm happy to chat. And thanks again. Have a good rest of your day.